People often ask me, do I come to this kind of a talk as a pastor, or do I come to this talk as a physician? Well, I come to this talk as fully both of those. I am fully pastor and I'm fully physician. Though I will say that from my physician lens, if someone asks me what I anticipate the outcomes of a particular disease, if someone has a particular disease, what do I think will be the outcome? Now, certainly through my pastoral lens, I absolutely do know that God works miracles. And I've seen God do things that I could only explain by way of a miracle. But my default actually is the survival data. What are the numbers? That's kind of my starting point. But what I've learned to do is to stay where people are and to be on that journey. And even with regard to the issue of miracles, I have found that people, it's often not a static conversation, but it's something that's evolving. And so I may have someone like my friend that I've referenced who very much in the beginning, absolutely not, regardless of what your data shows, I absolutely am firmly persuaded that God is healing me. And so they may be what some people would say would be in a denial stage. But as time goes on, as more of the data comes in, as they begin to have more experience, sometimes that absolute firm confidence that God is healing will become, I believe that God will heal. I hope that God will heal, until we get to that place where, just like Jesus said when he was going to the cross, Jesus, who didn't want to experience the crucifixion, let this cup pass from me, yet not my will, but thine be done. And patients can get there for the most part if we're willing to stay with them. I think the important thing is to stay in conversation, because oftentimes I've seen clinicians really dig their heels in. And so that the individual, the patient now, not only has to defend their own belief, but now they've got to defend the name of Jesus Christ. But if we can just stay with individuals all along the way, trying to be better at seeing them and making it clear that I'm here for the long haul. That's the thing that really matters, and that's the thing that best positions us to be in conversation and to support the patient.